Okay. I haven't shared the screen yet, right?
Not yet. Shrimate is on placement, so you're actually listening in from placement? Nope.
Maybe she's got afternoon shift.
Oh, okay, right.
Okay, all right. So let's get started. Firstly, so everyone can see the screen, the PowerPoint slide. Everyone's good. Everyone's good with that. Okay, just give me 1 sec. Yun, can you hear me?
Yep, I can hear you well.
Okay, so sorry, I'm just trying to navigate multiple screens at once.
All good.
Okay. All right. So, any questions from anyone before we get going? So, the prime importance of today is essentially to get you ready for the final exam, the end of trimester exam. So, like you probably saw Friday, we've sent out a study guide for the final exam. So that is the best way to prepare for it. There won't be any questions outside that exam study guide. So essentially, if you follow that to the T, all the questions will be derived straight from that. Essentially, what Yun and I did was we had the exam open in front of us and we just created that guide as we went. So essentially, every single question is from or will be reflected in that guide. So if you follow that, because we understand there's a lot of content that you need to get through in the course, so we've kind of refined it down as best we can. And if you follow this with you when you start to prepare for the exam, you'll be very well placed. The 20th, I believe, is that right, Yun?
Yep, so the final exam timetable for students will be published on the 20th. So in 4 days' time, you'll get to know all your exam schedule.
Yep. Okay, so today what we're going to cover is just quickly some announcements. Then Yun will go through structurally what the exam will be like in terms of the parts and so forth, and then we'll go through the guide itself. So starting with just a quick couple of reminders, the concept map assignment you've all submitted, we have about a 3-week turnaround time. So I believe this takes us to about the 30th to the 31st of May. Is that right, Yun? I always get the dates
Yep.
wrong. So I've given the markers 3 weeks. So that will take us to the 30th. Yun and I will have to then take into account the late submissions, just to ensure students who have had an extension that we just got to make sure that that marries up to their late submission time. So that takes a little bit of time because and we can't do that until they're all marked. So that takes a bit of time because there's so many. There's probably upwards of 100 students who have had some extension. So it's a bit of an administrative challenge. So it's probably going to be either late the 30th or sometime the 31st, but we'll do our best. And then the last bit of assessment you have is the online quiz 4, which is assessing the whole of module 7, and that will open Wednesday, June 1st at 5 p.m. and close the Friday, June 3rd. So just make sure you don't forget that final exam. Put in your calendar now. You don't want to forget that one. That's an easy 5 marks. So you don't want to jeopardize easy marks. Okay, so what I think I'll do, the next 3 slides are a bit about the exam format and how it will run, etc. So I'll probably just pass you over to Yun and Yun will take over. This is just a snapshot of what's coming out of your course profile. So this part hasn't got a huge amount of information. We'll elaborate on that, but this is just outlining the parts that you're already aware of. So I'll pass you across to Yun now.
Sure, and we might as well just go to the next slide, Matt. Yep. Is that the next one? Slide
This-
4.
This one is, and then this is
Yep.
5. This is 5.
Yep, sure. Thank you. So, obviously the exam will be worth 50% and it will be an on-campus exam. I'm sure last year you guys have already experienced at least one on-campus exam. It'll be the same. Everyone will have to go on campus and sit the exam. Obviously, you will need to bring all your pens, pencils, erasers, etc., preferably in a transparent pencil case that your exam invigilators can see through. And for those of you for whom English is not your first language, you're allowed to bring a non-electronic English translation dictionary. The electronic version is not permitted, so only the paper version of the dictionary. No need of calculators. You won't be asked any questions that ask you to calculate. And in terms of exam time, you are given 2 hours, including what we call a 10-minute perusal time. So during the first 10 minutes where you're only allowed to read your questions, you probably won't be able to write on your exam papers, but it really depends on what the exam invigilators will say. However, you will have that 10-minute reading time at the start of your exam. And your exam will consist of MCQs and SAQs. And especially with the multiple choice questions, the questions will be on the exam paper. However, your answers will need to be transferred to what we call a Mark Sense card. Now, I can tell you a story. In the past, I've had students who forgot to transfer their answers to the Mark Sense card, and unfortunately, those students didn't get any marks for the MCQ questions. So please make sure that you transfer your answers if you've checked your answers on the exam paper to the Mark Sense card, because those Mark Sense card will go into a machine and that's how they get marked. In terms of SAQs, so short answer questions, you'll need to write your answers on the exam paper. And if you look at the exam paper, you will have either lines or spaces where you can actually write on them. So please, also be mindful of the number of marks that are allocated for each of the short answer questions. Any questions so far? I'm sure you guys are familiar with the exam format and the logistics from last year. If no, let's just move on to the next, Matt. So in terms of the structure of your exam, you will have 48 multiple choice questions. They're worth 1 mark each. There will be 6 questions per module. And for module 7, just because it's quite an extensive module, you'll have 12 questions from that module. Jade just asked, are we allowed to highlight during reading time? It really depends on exam invigilators, but it's called reading time because you're only allowed to read. Okay. Moving on to the SAQ part, you will have 52 marks allocated. That doesn't mean that you'll be asked 52 short answer questions. There'll be short answer questions that are worth either 1 mark, 2 marks, 3 marks, up to 12 marks. Okay. And in total, that should say in total there, not in today, you will have 9 questions that are worth 52 marks in total. Okay, so obviously you will need to be mindful of the marks that are allocated and to see how extensive or how much you need to write for that particular question. So if it's just if it's a question that's worth, let's say, only 2 marks, then you don't need to write that much. But if it's a question that's worth, let's say 6 marks, then obviously we're looking for 6 main key points. Okay, any questions so far? Anything you'd like to add, Matt?
I think you've covered it well. Just with the SAQ, I think you said it, but some of them will have sub parts to it. So just look at the weighting of the question, and you could basically estimate what each section will be worth. So you might see, like as you can see here, there's a question that's worth 12 marks. So that will have subparts to it. So just ensure that you answer those subparts, which will be provided, the space will be provided on the exam paper. So have a look at the amount of space that is being given to you. That probably will give you an indication of how much you should write. But if you do need to go over, you can either, there's still a lot of space below the lines that are provided to you, and you can use the back of paper as well. I'm sure the invigilators will have some blank booklets, but you won't need to write extensively. You just need to answer what's been asked. We'll give you a practice exam, and we'll put some SAQ style questions on there. But yeah, in a way, Jessica, they will be similar. But remember, the ones of the case study, they're derived from reading a scenario where the SAQs won't be reliant on understanding a scenario to answer the questions. With the MCQs, they're going to be clinically applied. So there's going to be, in many cases, a little scenario at the front that will require you then, a question will require you to apply the knowledge you've learnt to be able to answer the question. Mariam, in terms of the practice, what we'll probably do, I haven't run this past Yun yet, but we'll probably do either next week or the week after. We'll, in the seminar time, we'll actually make it like an exam, and we'll give you the time to do it. And then I just have to confirm whether we'll give you the answers then and there at the end, or we'll give the opportunity. We'll probably give the opportunity to the students who haven't done the exam because of placement time to do it that week, and then we'll come back the following week to answer all the questions. Is that okay that way, Ewan?
Yeah.
Because I just think it's probably a bit of a disadvantage to allow students who aren't on placement to do a kind of an exam like condition and then give them the answers, whereas those who haven't had that opportunity will give them, well, they can do it that week sometime, and then we can give them the answers at the following week.
Yeah.
So, Mariam, it's either going to be next week or the one after, but very shortly we'll do it for you. Any other points here, Yun, that you wanted to add?
No, I think it's already 15 past. We should go straight into it.
Okay, so guys, what I'm going to do here is I'll go through the study guide for the patho part, and then Yun will go through the pharmacology part. So if you have your study guide in front of you, you can make notes here. If not, just take some blank pieces of paper and just jot down these points that we go through. So we'll just give you a slightly more insight into the guide itself and what we're expecting. So as I said, we made this guide with the exam in front of us. So that's how it was aligned. So pretty much what's there in front of you is all you need to know. There are a slight refinement from the learning outcomes that are in the module because we just wanted to give you a touch more direction, but by and large, they're going to be all the content you learnt, but just a significantly more condensed amount. As you know, in Module 1, we had 4 topics. So in terms of the pathophysiology that we want you to know for Module 1 for the exam, let me just pull up a pen. It's all going to be around inflammation. So inflammation is going to be the most important concept that you need to prepare for the exam for Module 1 in reference to pathophysiology. So what we want you to grasp is inflammation as a concept, but you need to be able to understand it completely as a process. So when we look at the cardinal signs, so these are the local cardinal signs, just remind me what they are, just so I know that you know. And just to make sure you're all awake, what are the clinical signs? Yeah, redness, heat, good, Georgia. Adele has got swelling, heat, redness, edema, loss of function, pain. Yep. So with those, what we would expect you to know is how they actually occur physiologically. So you need to understand what's actually happening at the tissue level for those to come about. Okay, so you need to be able to explain those. Now, when we say explain, this could mean that there could be a short answer question about you actually explaining the process, or by understanding how to explain it, you'll be able to answer the MCQs that will be kind of asking or assessing those style of questions. So you need to know inflammation, you need to know the cardinal signs, and physiologically what are causing these cardinal signs. And by knowing that, then you know the kind of process of events, what's happening immediately, and then, over time, things are happening, maybe hours later or even a day later, opposed to what's happening almost within seconds. Okay, so that's all wrapped up in inflammation. There's also going to be, I know you've mentioned it, pain. Pain is one of the cardinal signs, but you need to know, explicitly why a person would get pain associated with inflammation. Okay, that will also feed into the module on musculoskeletal, where pain is heavily assessed. So pain is going to be a very important topic area that you need to understand. The other thing that I'll mention is within the inflammation, you need to, you've already mentioned the cardinal signs, which are the local signs and symptoms, but you also need to know what's happening systemically from a signs and symptom point of view. So how do you know your patient's got inflammation? What kind of systemic bodily effects would you be expecting to see? This could be visually, or measurements that you would do, or blood tests, things like that. So make sure you have a good grasp of that as well. And this would also slightly encompass chronic inflammation as well, because we're moving, if you don't resolve acute, you go into chronic. So you do have to have an understanding of the difference between acute and chronic. Okay, so that's module 1. Is that okay for everyone? Any questions? Now remember, I'm just discussing pathophysiology. Ewan will come back and talk about the pharmacology, but that's in terms of the pathophysiology. As you can see, where our expectation is heavily on inflammation. Any questions before we move on? Okay, so now we go to microbiology. So this is module 2. So what we want you to know in microbiology is the course of infection. So this is the physiology of infection. So what kind of things am I talking about here, or would I want here in terms of the course of infection? So these would be the kind of stages that we go through in a typical infection. Not the causation, Bethan, but when we talk about the course of an infection, the process of an infection, the physiology of infection, what stages do we move through? So what's the first thing that kind of happens to get infected with a bacterial fungus? Yeah, so that's right, Georgia. So you need to get invaded by the organism, it needs to incubate. Then you go into that prodromal phase. So you need to know what's actually happening. What would you expect to see in the prodromal stage? Then what happens when you move to an active stage? What's happening in that course of infection? And then where does it go from there? So if it doesn't resolve, what's the outcome? If it resolves, what happens there? So you need to have a good idea of within the different stages, what would you be expecting to see clinically? Okay. Another aspect with that infection is the difference between local and systemic signs and symptoms. There's a lot of overlap with this with inflammation, because a lot of the clinical signs of inflammation, systemic clinical signs of inflammation, is pretty similar to the systemic signs of an infection, because an infection does cause inflammation. Okay, so you need to know those stages. Okay, there isn't too much expectation in terms of the microorganisms, because it can get a bit fiddly. The only thing that I will mention is that you need to have a good grasp on how a human cell is different to a bacterial cell, because this will set you up very nicely for the antibiotics, which Ewan will talk about. But we're not going to expect, nitty-gritty viruses, bacteria, fungi, parasites. We're not going to ask that. It's much heavily more around infection, stages of infection, and clinical systemic signs of an infection. Okay, so that's module 2 done. Any questions about that? Happy to move on. All right, so now we're moving to immunology. This is module 3. Okay, so this first point is significantly around the 2 divisions of the immune system. So again, just remind me what they are. What are the 2 divisions of your immune system that you think that I'm referring to here? Great, Adela. So that's exactly what we want. We want you to know the innate versus the adaptive system. We want you to know the big players, so the cells that are involved. What do they do? So if we talk about a B cell, you need to be able to tell us what a B cell does. And you should know. Do we know that there's different types of B cells? Does anyone want to tell us what the different, as examples, what are different types of B cells? I know this has been a little bit of a time. That was week 3, so you haven't. I think we're 6 or 7 weeks later, so you maybe have forgotten a bit about this. But does anyone remember? Yeah, we have memory. We have plasma B cells, and then we've got helper T cells, cytotoxic T cells, and then when you go into the innate system, we have things like macrophages, neutrophils, things like that. Okay, so you need to know what these cells are doing, how are they different, how are they important. Okay, so that's that first step. Then we go into the hypersensitivities. So there are 4 types of hypersensitivity reactions. You need to be able to separate them. You need to understand how they're different. What's the process between the 4 of them? What causes them to be different? What are the outcomes? What things would stimulate them? What is the process behind them, the signs and symptoms, etc. And then you go heavily into a type 1 reaction and focus on anaphylaxis. Okay, so anaphylaxis will be the heaviest one that will be assessed out of the 4 types of hypersensitivity. So we know that anaphylaxis is part of a type 1 hypersensitivity reaction, but you need to really have a good grasp of anaphylaxis. So what happens in anaphylaxis, what clinical manifestations occur, and then when we go to treatment, Ewan will talk about that a bit, but treatment in respect to anaphylaxis. And then finally, we look at autoimmune disorders. So what I want you to know there is just generically, what's happening in the body to cause an autoimmune disease or disorder. Okay, you need to also be able to provide some examples. don't be too obscure, just go with the ones that are common. Okay, so you just have to have a couple examples of an autoimmune disease, but the expectation is generically what happens in the body for an autoimmune disease to happen. Okay, that's it. So that's it for module 3. Happy with that, guys? Any questions about module 3? Okay, moving on. Moving module 4. So this is all around cancer. Okay, so neoplasm cancer. The big things you'll need to know are the diagnostics and the generic treatments for cancer. Okay, so you don't have to get too specific on the different types of cancers. We just want you to be able to say, well, in a typical kind of approach to try to diagnose a cancer or cancers, what diagnostic investigations would be available to a clinician, okay? And you need to know how they work. So how are they beneficial to provide a diagnosis? And same with the treatments. When we look at the treatments, and again, remind me, sorry to ask you all these questions, guys, but what are the generic treatments for cancer? You should have got this from your concept map assignment. What are the generic, meaning I don't want you to focus specifically on different cancer types, but okay, we've got chemo, we've got radiation. One more, Natasha. Surgery, great. So they're 3 examples of how you can approach a treatment and management for cancer, and it doesn't really matter if it was breast, bowel, prostate, brain, lung. Those 3 are going to be, yep, Jade, that's correct. Medication's kind of wrapped up in chemo. Chemo is, could be the traditional chemotherapy agents, but also the immunotherapies as well. Yep. You also need to know heavily how do you stage cancer. So you really need to go through the TMN system. So the tumor, the nodes, the metastasis, and you need to know how they're graded into each one of those subcategories, okay? So there could be MCQs on what stage is this, or there might be a SAQ on how would you grade, what things are you looking at, okay? What else do we have? So we've got stage and diagnostic trait, and then the generic signs and symptoms. So again, I don't want you to get focused on particular types of cancers, but just generically, what would be some warning signs for cancer? Can anyone give me an example, just so we know? Okay, great. Bethan, weight loss. So you need to be able to look at the most common warning signs for cancer. Be able to kind of discuss why you would get that particular outcome. What's happening to cause that? Yep, anorexia. Well done, Jade. Okay, so that's cancer done. Happy with that? Moving on to module 5. Module 5 is musculoskeletal and pain. All right, so we've really refined this down. The only thing that we really want you to know around fractures is really the if you're managing a person with a fracture, what are the clinical manifestations you're wary of? What are you looking for with a person who's just had a fracture? Okay, so these are kind of the kind of clinical manifestations, not just the bone's broken, they're in a bit of pain. What things are you concerned about by managing a person with broken bones? Things like that. Okay. But in terms of module 5, by far and away, the most important things is pain. You really need a good grasp of pain. And I will say this, but we tell this to the students every year. We say you need to really understand it well. And there are many questions that are done very poorly, and even in the SAQ, they're left blank. Okay, so that's really unacceptable, because as a nurse, as I've said before, pretty much every patient that you'll look after is in pain. So it's not unreasonable to expect that this is a very well understood concept. Okay, you'll become a very competent nurse if you understand pain, understand how it manifests, and then therefore how you can manage it. So what we want you to know is mostly it's going to be in the context of nociceptive pain. We won't want you to focus on neuropathic pain because that's quite a chronic neuropathic pain. It's very complicated and difficult. We just are focusing on, acute nociceptive pain. So you need to know all that's involved. So the fibers that are involved, the receptors that are involved, where they are in the nervous system, centrally, peripherally, where do they get taken to, the stages being nociception, transmission, perception, modulation, the neurotransmitters involved. I've written one other word that I can't read. Doesn't matter, but it's all wrapped in the pain pathway. So you need to understand that well, and that's where the drugs will fit in, and Yun will talk about that very shortly. But the nociceptive pain pathway you have to know very well. You need to know the different types of fibers. So this is C fibers, A delta. You need to know how they're different, the types of pains they carry, the neurotransmitters, how they synapse, things like that, because that will also underpin the drugs very well. So if you spend the time understanding the pathway, then the drugs will make a lot more sense. Okay? Is that okay? Hopefully you don't think that's an unreasonable expectation, but there's only a handful of deep concepts that we really want you to nail. That's one. Antibiotics is another. Pain meds obviously goes with it. And I really don't think that's an unreasonable expectation to have by the end of PMP 1. Okay, moving to module 6. Okay, so the ones that we want you to know is, in the context of genetics. So genetics will be kind of these points, but the first one is chromosomal. So we want you to know, we expect you to know that, what autosomal versus sex chromosome disorders would be found in those two different types of chromosomal disorders. Okay, and then not too deeply, but and this is really what you learned in A&P. So it's not really any more than you would have learned in the genetics part of A&P, but inheritance patterns. So this is just a recessive or dominant. If there is a condition that a parent has, you need to understand what the likelihood of the children or the offspring to inherit that condition. So you need to have an understanding between the dominant versus the recessive disorders and how that they would manifest in a percentage wise. You don't need a calculator, but you do need to be aware that what the likelihood in a percentage would be. And then the other aspect is aging. So what effect does aging have on the major body systems? So this would be, cardiovascular, respiratory, neurological, muscle, skeletal. What's changing over time. By understanding that particular concept, then you will do well with the pharmacokinetics, which is how do drugs move through the body differently through the different age continuum. Babies, children, adults, elderly. But Yun will talk about that. And then lastly, we have module 7, which are the neurological disorders. And so I'm not sure if you said this at the start, Yun, but in terms of module 7, we've said that there's 6 questions per module, but because module 7 is a big module, it actually has 12 questions, 12 MCQs in it, okay? Because we kind of break it into 2 parts. Does that make sense? So every section that I've just gone through will have 6 MCQs associated with it, but module 7 has 12 because it's a big module. So what do we want you to know from a pathophysiological point of view in module 7? Well, one of the huge ones is intracranial pressure. So you need to know how this comes about physiologically. Okay, so what's actually happening to cause an increased pressure in your skull? Okay, definitely you need to nail the Cushing reflex. Okay. Yeah, that we wrapped up. That's right, Lexi. So when we say MCQs, that's a combination of patho and pharm. Yep. So ICP, you need to know the Cushing reflex. Okay. Does anyone want to remind me what that is? You're probably learning this now, actually, because you're probably now on module 7.
Just to give you a hint, this was also mentioned in the last case scenario we looked at in the last tutorial.
So this is BP up, dropped. Yeah, and one more. What's the other one, Anna? Yeah, great. So you need to be able to explain that. You need to explain why these 3 things would come about the way they do, okay, in a process, in a physiological process. You also need to know what actually having an increased ICP may have in other, bodily effects, as in level of consciousness. As you know, one of the most important assessment tools that you'll do is GCS. So why does ICP affect the GCS? And then you might see motor dysfunction. So this would be the way that they may orientate themselves in bed. That would be different degrees of severity based on their ICP. Vision, language, that's in terms of, the speech disorders, but not too deep. It's really just the ICP, the Cushing reflex, what's happening in the body, in the brain for this to happen. Yep. And then we go into the TBI and CVAs. So CVAs, essentially the strokes, TIA and hemorrhagic ischemic strokes, kind of the risk factors behind them and how they kind of manifest, but also in their other 3 types of hematomas. So this would be based around the meninges. So you should know you have extra or epidural, subdural, and then the kind of intracranial one. Okay, that's for that part. And then we go into dementia. Okay, so you need to be aware of dementia as a process, what's happening in the brain to lead to that state. And then when we look at specifically the 2 big neurodegenerative diseases, it's going to be Alzheimer's and Parkinson's. So nothing about MS, motor neuron disease. You can forget those once you've done your quiz. It won't be assessed in the final exam. We'll focus on Alzheimer's and Parkinson's. Alzheimer's will, come from this anyway. So if you've understood this step above, you'll get Alzheimer's pretty well. Parkinson does have dementia associated with it, but it's also got motor dysfunction, and you should be aware of what's happening to cause that. So that's it. That's the pathophysiological part of the exam. So this would be wrapped up in the MCQs, but also the SAQs. And if you go through what I just pointed out to you, you'll do very well. Okay, because as I said, we made this guide with the exam in front of us. So nothing will be assessed outside this guide. Okay, moving on to Yun, you take over.
Yep, thank you. So moving on to the pharmacology side of things, guys. Module 1, cellular cellular pharmacology. Explain the mechanisms of action, clinical indications and side effects of the listed steroidal and non-steroidal anti-inflammatory drugs. So if you look on your course content, obviously it mentions, it lists the different types of NSAIDs and steroidal anti-inflammatory drugs. So those are the ones you need to know. And you actually need to be able to give examples of each of those categories. So can we quickly just put on the chat some examples of steroidal anti-inflammatory drugs? What's an example of? Okay, yeah, you've got prednisone. Yeah, dexamethasone. Yeah. So there you go. So you already know the different types of steroidal anti-inflammatory drugs. So now you need to try and have a good understanding of their mechanism of action. Okay. What about NSAIDs? Throw at me the different examples of NSAIDs. Yep, very good. Aspirin, ibuprofen. So there you go. You already know those different examples of drugs. So you need to know exactly how they actually work in the body. So the mechanism of action, you need to be able to explain them in your own words. Okay, very good. Yes. Yep, celecoxib, parecoxib, diclofenac. Those are really good answers. Okay. That's basically it for module 1, okay? You need to know the mechanisms of actions of the medications that you've just mentioned on the chat, okay? Right, let's move on. Module 2, microbiology. So categorize the different classes of antibiotics. Provide at least one generic antibiotic example for each category. For each antibiotic listed, explain the general mechanisms of action and notable side effects. And then define antibiotics, different spectrums of use, and how antibiotic drug resistance develops. So basically, all you need to know from module 2 in terms of pharmacology is your antibiotics. Now, does anyone remember the 4 main mechanisms by which antibiotics work? Let's just put them on the chat, guys. What were the 4 main mechanisms of actions of the antibiotics? Yep, very good. Cell wall synthesis. Yep. So, yep. DNA, preventing DNA synthesis, stopping protein synthesis, stopping folate. Yep, very good. Stopping DNA. Very good. So basically, you need to be able to explain in your own words these mechanisms of actions. Okay. Obviously, it's not just enough to list the different mechanisms of actions. You need to be able to explain them in your own words. Okay. You may use bullet points in the short answer questions if you're asked to explain them, but what you really need to make sure is that you need to be able to explain them, okay? And obviously, you need to be able to give examples of each of those antibiotics, okay? So yeah, basically module 2, you just need to focus on antibiotics only, okay? Moving on to the next slide. So module 3, immunology, explain the mechanism of action of main side effects for the main immunosuppressing agents. So if you look on your course content, there's a list of immunosuppressing agents. So those are the ones that you obviously need to know. I'm not going to say you need to know every single one of them. However, you at least need to know the mechanism of action and which medications are used for which particular hypersensitivity. Okay. I'm going to say this, you will not have a lot of questions from this particular module. Okay. But obviously you do need to know to get these questions right. Okay. let's just move on. Like I said, you won't have a lot of questions from, well, questions related to pharmacology from module 3. All you have to do is just to revise what's on the course content, and that's it. Okay. Module 4, cancer. So describe the generic treatments for cancer. So Matt has already mentioned some of the generic treatments, but in terms of pharmacological treatment, there are quite a few medications, chemos that are actually listed on your course content. So those are the ones that you need to know. Okay. Again, not a lot of questions were retrieved from module 4. So you don't necessarily need to spend too much time studying and retaining all of those. Okay, just try to understand, the mechanism of action of those chemotherapeutic agents. And obviously, we all know what the most common side effects are. We've already just sort of discussed this in your last tutorial. So again, not a lot of questions from module 4. Module 5, obviously this is probably going to be one of the modules that you need to spend a lot of time studying, especially in terms of pain medications. Just as Matt had emphasized, you really need to know, like the back of your hand, the pain pathway. You actually need to be able to, explain how pain pathway works. And to add to that, you need to know where each of the analgesics work within the pain pathway. So for instance, let's just take an example. Where in the pain pathway, just tell me on the chat, would local analgesics work? Would it be, at the thalamus? Would it be at the start of the pain pathway? Where would things like lidocaine? Yep, very good, Anna. At the site of pain, so at the start of the pain pathway, right? So basically, you need to know where in the pain pathway each of the different types of analgesics would work. And obviously, you need to know where opioid analgesics will do its job in the pain pathway. Okay. In terms of actual opioid analgesics, obviously you need to know the mechanism of action. You need to be able to give us an example of an opioid analgesic, and obviously you need to be able to give us some of the common side effects. Now, speaking of side effects, it's just not enough to just simply list or mention the side effects. You need to know how those side effects come about. Okay, so let's just take an example of, okay, constipation, for instance. We all know that it's a common side effect of opioid analgesics. How do they work? Why do we have constipation? Okay, very good. Reduces peristalsis. So that's the kind of things that you need to know. Not enough to just list the side effects. You need to know what's behind, what mechanism is behind those side effects. Okay. Right. Let's move on. Next slide. Last slide. Matt. Module 6. So in terms of genetic congenital disease / the effects of aging and health, all you need to know from this module in relation to pharmacology is how aging will affect pharmacokinetics. So basically, for those of you who attended or listened to the last seminar, we talked about pharmacokinetics and aging, right? So what what changes need to occur in terms of drug administration for those who are elderlies, okay, for instance. So as we age, what changes need to occur in terms of pharmacokinetics, basically. And pharmacokinetics, we do know that it comprises absorption, distribution, metabolism, and excretion. Okay, so basically you need to focus your studies on, okay, what are the changes in absorption, distribution, metabolism, and excretion for the elderlies when they're given medications. Okay, hopefully that makes sense. And lastly, module 7. So just a few things within module 7, just because it's such a big module. First of all, you need to know the medications for seizures. Okay, if you look on your course content, there'll be a list of medications for seizures. Those are the ones that you need to know, especially how they work. So the mechanism of action of seizure medications. Okay. Next, explain the effects observed after stimulation and blockage of adrenergic and cholinergic receptors, respectively. So you will need to be familiar with adrenergic receptors and cholinergic receptors. Okay, so there's alpha receptors and beta receptors. In terms of adrenergic receptors, you need to know where these receptors are located. Okay, what they do, you need to be able to give us some examples of medications that will act on those receptors. Okay, and in terms of cholinergic receptors, you'll notice that there are 2 subtypes. There's nicotinic and muscarinic as well. So those are the ones that you need to familiarize yourselves with as well, and be able to give us an example of the medications that act on those receptors. Okay, module 7, adrenergic receptors and cholinergic receptors, and adrenergic pharmacology and cholinergic pharmacology will probably be the most extensive module that you will need to study for in terms of the pharmacology side of things. Okay, just because there's just quite a lot of receptors, but I can guarantee you that this would definitely be assessed. Okay, any questions? I think we've got 5 minutes or so for questions. Anything you'd like to add, Matt?
No. Did brilliant.
Any questions, guys?
All right, so what I think we'll do is next week, so next Monday, we'll do a practice exam.
Yep.
But we won't go through any of the answers, and then we'll follow that up the week after with the answers. If there's anything else that you would like us to add to the following couple of seminars, just email us. So if there's a particular concept or something that you're still struggling with, just let us know, and we'll try to cover that at either the end of the prac exam or the session when we go through the answers. Other than that, I think that's about all. If you guys don't have any more questions. No problem, Mariam. You're welcome. We just want to ensure that you guys all get through it and you do well. So far, the markers that I've spoke to have said the students have done very well this year with the concept maps. So that's good to hear. But that's only 1 week in. But Some of the markers that are very experienced, marked for many years, they've said it's definitely done better this year than previous years. So good to hear. Let's hope the same with the final exam. Okay, let's leave it at that then. Turn off recording.